So Raguj says, generally, I agree, but why are you so worried about transgender medical intervention? But you said no word about cisgender people getting gender affirming care like fake boobs or genitalia surgery. Why an adult trans person has to go through complex or complicated processes, and at the same time, cisgender people can do every surgery they want without examination or diagnosis to prove they don't have any body dysmorphia. Okay, so this is a very common question and maybe criticism I think that people have when people talk about the importance of, taking it slow in gender therapy or the gatekeeping question, right? I think a lot of people do have the same question as Raguj. I think the starting point for me here is that there are fundamentally different risks involved with surgeries like breast implants, for example. And when Raguj says genital surgeries that are supposedly gender affirming, I'm not sure what this person means by that. Let's just take an example of, a woman who gets a labiaplasty to make her genitals look more, I guess, aesthetically appealing, in air quotes, right? That's a complicated question, but if that's what you're talking about, right? There are fundamentally different outcomes and risks involved with that type of genital surgery or breast implants for a biological woman versus the gender affirming interventions like taking hormones or having, mastectomy, top surgery, or genital surgery for trans affirming care. Those are really, really different things. And I want to start out by saying I can totally understand why people don't make that distinction, because there are a lot of arguments, philosophical arguments, that sometimes advocacy groups or activists use to make it seem as though these things are exactly the same, right? And I think that's a big problem because, as I talk about all the time on this channel, when we're talking about reality, we're dealing in trade-offs.